Hi, my name is Dr. Christine Woodford. I'm a veterinarian and I'm certified in animal chiropractic and acupuncture. So this is Star. How old is Star?
Star is 5.
And so this is our third time treating her.
So when we got Star, she was so weak she couldn't get up. We had to lift her up, set her on her feet. She would sometimes walk, sometimes not, and then fall back over. Kind of got some meat on her. She was real skinny and noticed that she was still real weak in her back end. She also would drag the back of her feet so bad that they would start bleeding if she walked on concrete too long.
I remember we were checking like her proprioception when we first started. It's still slow.
It's still not, yeah. So since our first appointment, she now doesn't drag her feet at all when we're walking, so we can take walks with her. She is able to go up and down our stairs, which she couldn't go up and down the stairs at all. She would fall down them, actually, we found out. She's getting up on her own, running around our backyard playing with the rest of the dogs, which is awesome. She has such a fun time. She's just made amazing strides.
That's better. Oh, that was a good release. A lot of times when you get those vertebral subluxations released, they do a yawn or a lick and a chew. She's pretty tight in this left hip also. We'll do some acupuncture next, and then I'll stimulate the acupuncture needles with the MagnaWave machine, and then we'll check your range of motion again. And the goal with acupuncture, you know, it's a 3,000-year-old Chinese therapy. The Chinese believed that there was energy that flowed from point to point on these channels or meridians. And as long as the energy was flowing, systems were working well. But certain things would block the flow of energy, and that would cause pain and then eventually disease. And so they believed that the needles would help stimulate that flow of energy. We've been using acupuncture in the US since the late 70s. But now that we've done some more current research on the acupuncture, they've done studies where they've pulled blood on the animal and then did the acupuncture and then retested the blood, and they found that the acupuncture does increase the flow of good cortisol levels, good neurotransmitters, good endorphins. So it definitely has a therapeutic effect. It's good for pain relief and stimulating the nervous system. So it almost helps them to heal from the inside out. You can see where she flinched there. That's considered a date cheat response, like a release of energy. She's really leaning into me. I'm always amazed, you know, I mean, it's stimulating to them, but then they, you know, many animals get very relaxed with the acupuncture needles in. And there's good points all over the body. There's 14 channels that run on either side of the body. And they're paired with organs, like there's a bladder and a kidney channel. We'll do that, you know, because we're trying to help stimulate her bladder function, her incontinence. The channels will either start or end by their face or their distal limbs. So I like to make sure we stimulate some ting points, the end of the channels, the energy flowing through all of the acupuncture meridians and channels. Good. I think that's enough stimulation. We did quite a few needles on her. We get most of the stimulation when we first put the needles in, like you could see from that like skin response. The longer they're in, it's an added bonus. Then there's different ways to stimulate the needles. This is a MagnaWave machine. There's wires in the loop, and the electricity is pulsated through there. It creates a magnetic field that goes deep into the tissues, and it helps to open up the cell membranes to let more good oxygen in and waste products out. I'm gonna put it between her legs, really stimulate her pelvis, all those nerves there. You can really see the muscles pulsating there. This I find works really well with dogs, you know, that are sore like in the hips, pelvis, low back. Whew. She's such a good patient. Okay, now we're gonna take out the needles that are left. Then we'll check your range of motion again. Check your shoulders. Ooh, did you hear that shoulder pop?
I sure did.
Wow. That audible is the air escaping from the joint spaces. We don't always get that. I'm always amazed after feeling them that acupuncture really helps to release like the tight muscles. Helps them to be looser. Can we check your proprioception in your hind legs? You're
look at that. So much faster that she's like, nope. Yes.
Ah, very good. You know where that hind leg is, don't you? Let me check this one.
Yes.
Oh, much better. Look at that. Nervous system is working better, isn't it? Good job. I'm really happy with the quicker response that she had there.
You know, when we first got her, she would walk and she would drag her back like so bad that she would be walking on the toes.
Wow, and that's where she had sores on her toes too, didn't she?
Mm-hmm.
That's so much better. She was so stuck on the right side of her neck. My name is Dr. Christine Woodford. I'm a veterinarian and I'm certified in animal chiropractic and acupuncture.